Hi. Okay, my topic is abortion. Abortion is a very controversial issue. I'm not here to debate whether it should be illegal or not. I am just here to discuss the harm abortion can bring to a woman's health. My main claim is that abortion causes physical and mental health risk among women. It is important for women to be aware of these risks before having an abortion. Abortion can cause depression and or substance abuse. Depression is something that many women suffer with after having an abortion. In an issue brief titled How Abortion Harms Women's Health, a research team in New Zealand analyzing data from a 25-year period found that abortion in young women is associated with increased risk of major depression, anxiety disorder, suicidal behavior, and substance dependence. Further studies show that those who abort report more frequent sleeping problems, more frequent marijuana use, and increased need for psychological counseling when compared to adolescents who give birth. In an article in the Daily Telegraph, Professor Coleman's study was based on an analysis of 22 separate projects, which analyzed the experiences of 877,000 women, of whom 163,831 had had an abortion. This study said that the abortion was linked with 35% greater chance of anxiety disorders, 37% higher possibility of depression, double the risk of alcohol abuse at 110%, and 3 times greater risk of cannabis use at 220%, and a 55% greater risk of trying to commit suicide. That leads to my next claim. Abortions can lead to suicide. Elliott Institute presents a new finding at the International Women's Health Conference. The study found that women who have had abortions are more likely to commit suicide than those who have given birth. The average annual suicide rate per 100,000 women was 3.0 from delivering women compared to 7.8 aborting women. The national average suicide rate for women between the ages of 15 to 44 is 5.2 per 100,000 women. This shows that aborted women have a higher suicide rate than women in general, while giving birth actually reduces women's suicide risk. A quote from that same article: the data clearly shows that what we have long suspected, that abortion is harmful rather than helpful to women, said Elliott Institute Director Dr. David Reedon, one of several researchers working on the study. Women seeking abortion should be informed that abortion is associated with significant physical and mental health risks. It also deprives them of numerous physical and mental health risks associated with childbirth. Other things aside from death can occur while having an abortion. My next thing is, Okay, although death while undergoing an abortion is rare, it can still occur. My next claim is that abortions can cause death. Deaths occur during legal and illegal abortions. Statistics from Abort 73. In 2007, 6 women died as a result of complications from known legal-induced abortion. The number of deaths attributable to legal-induced abortion was the highest before the 1980s. In 1972, a year before abortion was federally legalized, a total of 24 women died from causes known to be associated with legal abortions, and 39 died as a result of known illegal abortions. Other things aside from death can occur while having an abortion. Complications can result from having an abortion. According to the American Women's Services, retained tissue, incomplete pregnancy, blood clots in the uterus, infection, hemorrhoid, severe cervical tear, anesthesia reactions, cardiac arrest are all complications that occur from surgical abortions. Retained tissue, incomplete pregnancy, blood clots in the uterus, and infection, hemorrhoids are complications that can result from a non-surgical abortion. In conclusion, women need to consider these physical and mental health risks before having an abortion. The harm that comes with an abortion can affect the rest of their lives and possibly end their lives. Thank you.
All right, you seem to be backing away from having an argument at the beginning and just saying you're going to discuss this. We don't want a discussion. We want an argument. That the argument is not about whether or not we should have abortion. That's okay. But define it as whether or not abortion is, in fact, safe for women. And your contention really should be that abortion has, like you said, those negative consequences. I thought it was strange, though, that you had the two parts of your speech. I mean, the claim basically has two parts to it instead of a singular claim, and so you've got multiple parts built into that. And then in the supporting structure, you don't just use those two parts, you actually have a third part as well. So I'm not sure why you put the two parts in the proposition to start with and then add one as you go along. It just seems like you might as well have left those out of the main proposition, kept it simple, and then used the other things to be the signposts of the supporting points. There's not really much of a preview as a consequence, and if there is, it's a little confusing. Now, on the body of the speech, I thought you did a pretty good job signposting as you got to those individual points, and it was relatively easy to follow each claim as you presented it, so I think you did a good job on that. I also think that you did a very nice job in citing the sources. You're consistent in presenting the sources of the material. The only thing that I thought was maybe missing was some dates, because although that research, you gave us the doctors or the institute, where the reports were published, that sort of thing, I didn't hear any dates associated or affiliated with any of that, so I don't know how old any of that data is. There's some good statistical information in a couple of the studies that you cite that seem to support the inference that you're drawing, so I thought you did a good job on that. There's also some general testimony. At best, there's some hypothetical examples, but I'm not sure that they were very convincing. And then there's some good factual data. You're doing way too much reading in the presentation. I know that there's a lot of quoted material here, but you never really look up. You need to just tell us what the argument is sometimes instead of reading the argument. You know what it is that you want to say. Just look at people and tell us those things and then go back to your evidence instead of trying to read everything. I know it's just a temptation when people have that there. They feel like I ought to read it, and it's not. You want to resist that temptation. All right. Thank you.